So how are you doing?
I've been doing better for 3 weeks, but yesterday I had 3 seizures,
Oh my God,
and
okay.
this morning I've had 2. My first symptoms of epilepsy, I was in my early 30s. I was working in the emergency room as a nurse. No family history. I've never had any brain trauma, nothing like that. I was asleep. My daughter was my witness. I was biting on my tongue. Both of my arms got all stiff. My name is Janet Guzman. I'm a registered nurse. I work in the endoscopy department at Houston Methodist Baytown Hospital.
Epilepsy is a chronic brain disorder caused by abnormal electrical activity in the brain that produces unprovoked recurring seizures that span a spectrum from mild to severe.
Even in patients that are having milder seizures where they don't have convulsive activity, they can still be quite dangerous because number one, they can become convulsions. If somebody is driving and all of a sudden they blank out, there's a pretty significant risk that they're going to have an accident. Let's say they're cooking. People can end up with significant burns. Amit Verma, I'm the director of the Comprehensive Epilepsy Program at Houston Methodist Hospital.
For epilepsy patients like Janet, a neurologist is the primary point of contact who gathers and interprets test data and then coordinates a treatment plan with the care team.
The role of a neurologist in a specific case like this patient's would be to determine, number one, if she has epilepsy, number two, to define if she is responding to different types of medications.
Patients who don't respond to 2 or more medications have what's known as drug-resistant epilepsy. Multiple epilepsy medications had failed to control Janet's seizures. For surgery to be an option, Dr. Verma needed to know where in her brain the abnormal brainwave discharges were beginning. Previous EEG testing revealed they were originating on the left side of her brain.
They're coming from the left side of the brain, but we're just not exactly sure where on the left side.
Once we reach the point where we really need to understand the specific spots, then we need to put these electrodes closer to the potential source. I'm Damiano Barone. I am an academic and functional neurosurgeon at Houston Methodist Hospital.
One advanced technique for evaluating epilepsy patients for surgery is stereoelectroencephalography, also known as stereo-EEG or SEEG.
Through very small boreholes that are made in the skull, the surgeon is able to introduce tiny needle electrodes that go into brain tissue where they can be placed really quite extensively across one or even both sides of the brain if required. We'll test those electrodes in the operating room to make sure that everything is good.
Okay.
Then you'll go to the ICU, take you off the medication and try to provoke some seizures in the ICU.
Right.
While you're connected to the EEG machine. But I think this will certainly give us a good idea where they're coming from and what the next step is for us.
Right. When I first heard about the SEEG procedure, a lot of thoughts were going in my mind thinking of the risk. I was thinking of my children.
Many patients are actually very scared to undergo epilepsy surgery procedures because of some of the misconceptions that are out there. Obviously, this is still brain surgery. There are still significant risks that are associated with brain surgery. But, in the right hands, especially in the hands of a good neurosurgeon, you can really reduce many of those risks.
One risk of the SEEG procedure is the possibility of not locating the origin of the patient's seizures, thus being unable to formulate a surgical plan. For Janet, it was a risk she was willing to take.
This is the next step that I need to take to improve my health.
In your own word, tell us what you're having done today.
I'm having a intracranial EEG. God willing, I am going to do what I need to do to improve my health. Just this past December, I had 5 seizures that month. God has a plan for me. I am a true fighter. I'm not going to give up and not let these seizures control my life. I'm going to continue to move forward and just see what my options are to get healed.
As you know, we're going to do an exploration of the left side of your brain. At this point, I'm planning to put 9 electrodes.
9.
So we're going to monitor your frontal and temporal lobe. Then you wake up and then go up to our neuro intensive care to start the monitor. In the past, there were no robots, there was no advanced imaging, few electrodes were put in the brain, and the risk of having a complication from this electrode was very high. Advanced imaging allows us to really plan where the electrodes needs to go, but also we have robots which we can guide with less than a millimeter error in inserting this electrode inside. This makes the operation safer, it makes actually the operation faster, and allow us to do something that in the past we couldn't do, which is putting more electrodes. Every small error in any steps can have devastating impact. An electrode that is off even by just a few millimeters might hit an important vessel and can cause an hemorrhage. Everything has to be perfect. Here we are using an intraoperatively CT scanner where we real-time imaging the brain to make sure that the electrodes are delivered where they need to go.
Last night I did get my nighttime seizure medication, and then this morning they gave me just one of my seizure medicines, and they're gonna slowly take me off of my seizure medications to see, for me to have a seizure.
Hello. But I mean, you look pretty good for somebody who just had surgery yesterday.
Yeah.
That's
Thank
a
you.
good thing. Let me
Yes,
check
sir.
a few things. Just check my finger, follow my finger with your eyes, don't move your head. You don't see double anywhere, right?
No, sir.
Okay, show me your teeth. Okay, open your mouth, stick out your tongue.
Oh, that hurt.
Oh, that hurts, sorry. Okay, no worries. Take your index finger and then touch my finger. Okay, that's good. How about this hand? Okay. Can you move your toes?
Yes,
Move
sir.
your legs? Okay, that's good.
You haven't had a seizure yet.
No.
Okay, so I guess it's a waiting game now. You usually have at least once or twice a week.
Yeah, but sometimes it's like spread out. It can be, I go like sometimes 3 weeks without having a seizure.
Oh, we
And
want you to have a seizure.
Lots of stress. Get mad at my kids or something.
Can we call your kids in?
Yeah, we'll call them. They'll be
Jump
here.
on the bed.
Yes. Show me all the stuff that they haven't cleaned up at the house.
Gracias a Dios que
My family has been such a big help. We talk every day. Dr. Barone, he came in early this morning.
Oh, that's good.
He just said that the scan looked great. There wasn't any bleeding.
No bleeding at all.
Bleeding at all.
That's great. That's
Yeah.
good news. The whole family, they've been calling us and sending messages. You know, everybody's got you in their prayers. So your grandma called this morning also. Yeah, even though she knew because of all the messaging that was going on, she wanted to talk to your mom and hear that from her that you were doing fine. Yeah.
That I'm doing fine.
Yeah, you just hang there. I know you don't quit, and that's something that we always say at home. You know, you never quit.
I just want to thank God for helping me. Bring me here. Sorry. And for other patients that may be going through a similar situation, to not give up. And that there is healing, and be an advocate for yourself. So don't give up.
You came in on June 16th and we stopped recording a week later on June 23rd.
Right.
I'll show you the seizures just so that you have an idea of what we're looking at. We recorded 7 seizures total.
Wow. 7?
What we saw basically on your recordings was that it's in the front part of the temporal lobe. This is the area of the brain just behind the amygdala. You see this big black thing here?
Yes.
That's where the seizure is starting. So our goal is basically to sort of remove this area and this area.
We had some suspicion from some of the MRIs that she had some small holes at the base of her brain.
This is an X-ray of your skull, and these wires are those electrodes that he implanted. You see this one here,
Yes.
and then this one.
Yes.
These deeper parts,
Yes.
that's the area where we think most of the seizure activity is coming from.
They are called encephalocele. Basically, some small part of her brain were just going through some small hole in the bone.
Our goal is to take out as little as possible, but feel confident that we're taking out enough.
Okay.
The left side of the brain controls speech function. So we have to obviously make sure that we're not affecting speech, we're not affecting motor function.
Right.
Anytime that we try to operate on this area, the chance to make the patient unable to speak again is very, very high. It's a big risk, and that's why surgery in this area is done in very few specialized centers, because we need to employ a set of techniques to try to preserve language. We discussed all your results in our conference, and everyone agreed the best chance of cure is by removing your temporal lobe, or the anterior part of the temporal lobe. Now, common complication that can happen is infection and bleeding. We gave the good news that there was chance to cure her epilepsy, but at the same time we had to have the difficult conversation to say this will require open brain surgery. This will cause potential risk to language and potentially to life. You see all those white things?
Yes.
Are the vessels. And we do everything we can to preserve it, because that vessel brings food and oxygen to certain part of the brain.
Yes.
Brain's also very, very important. That's the blood's coming from the brain back to the heart. Again, if they get damaged, they don't forgive us. So we'll be very careful. Other function is memory. We don't know how this is going to affect your memory. And now the big ones. Stroke and risk to your life, death. This is an operation in your brain. It's a major operation. Things can happen. It's very rare, but it's possible. We had very frank conversation of where we're going. But at the same time, we were comfortable that we've done this many times. We knew what the risks are, but we also know how to prevent them. Dr. Verma's team will be in the OR to help me doing the neuromonitoring testing.
Okay.
So we'll be monitoring your motor function, your language. I cannot guarantee you'll be seizure-free, but we believe this is going to be the best chance to be seizure-free.
Lord, I just ask that you continue to just guide the path, that it is so clear for the destination that we're for today. Amen.
Amen.
I'm ready.
We're all ready to go this with you.
Yeah.
And in just a matter of minutes, it's going to happen. And we're all glad. I mean, we're not afraid.
No.
We are glad that this is happening.
Long overdue.
Yeah. Mira, doctor, let's get it over with.
I already told him, don't mess me up.
Let's go. Let's get it done.
I still got lots to do in life. Don't mess me up. Come in.
Hello, good morning.
Good morning. Buenos días.
Ready?
We're ready.
As ready as you can be. Okay. Temporal lobectomy, or any brain resection in a patient, it is a highly stressful procedure. The idea behind brain resection is that we're going to improve the quality of life of patients, but at the same time we keep them safe and able to enjoy their quality of life without paralysis, language problem. I have behind me 20 years of training and experience in performing this procedure. I look again the imaging, I do 3D reconstruction, I exactly see where every single vessel goes on the surface of the brain, deep on the brain. But on top of that, there is a team. The support and preparation is what make us be cool during these highly complex and stressful cases. I think every surgeon has small routines. My routine is I always put socks with, they are theme-based, depending on the operation I do. This was the day of brain surgery, so I was wearing brain socks. I know that when I'm wearing these socks, things go well. We are linking the brain to our neuronavigation machine. And every single time we can see where we are, so we make sure that the language is safe. I have my resident, Ryan, helping me. This is an operation that requires more than 2 hands.
Do you agree that is the 4 centimeter mark?
I agree.
Okay, let's do it. Bipolar. Hello.
Hey, how are you, Damiano?
I'm good. Hi.
When you open up the ventricle, just we can slide a strip in there and record some EEG and then do it again once you finish.
Perfect, yeah, we can do.
I was discussing with Dr. Verma, and I said, Dr. Verma, I think I'm seeing the holes and the potential brain coming through. I think we should test this. Dr. Verma agreed, and he came in and we performed that advanced electrodiagnostic test where we put electrodes on this small bit of brain coming through this hole to see if they were responsible for her epilepsy. We verified what I was thinking was right.
And we'll take out the hippocampus.
Yeah, but don't go too far back or...
We're not going to go chasing back.
The critical point is when we reach the deep side. The deep side is where the structures, the bit of the brain I need to remove, are attached to the brainstem and the carotids. Any injury to this structure, which are just millimeter away, will pose not just function but life at risk. We use advanced microscopy and imaging to make sure that we do this as delicately possible, peeling away the epilepsy tissue away from these very critical structures.
There it comes. Nice.
The pathologists are the doctors that I'm gonna receive the tissue that I'm taking from the OR, and I'm gonna analyze it and see, okay, this part of the brain is abnormal, was likely causing epilepsy. The pathology did confirm area of brain that were not supposed to be there, and we have taken all those areas out.
So, surgery 2 weeks ago, how did it go?
Yes. I'm healing, obviously. No drainage or anything. Sometimes still with my hair, I feel like my ears are stuffed, but I can still hear like whoever's talking, but I just feel like they're stuffed up. At night to sleep is very uncomfortable. Can't get like a comfortable position, trying different pillows and things, and of course not sleeping on this side. I'm just glad to be done with this.
Yeah, I mean, you had big operation, all went well. Yeah, I can hear that your language is completely normal.
Yes.
I mean, that was the concern, was the language and the memory. So language is normal. How is the memory? Have you noticed any difference?
The memory, sometimes like a short-term memory, like if I'm having a conversation, like if I was helping like with cooking or something, I just completely say something different, or I'm like, I don't remember what I was gonna say.
What about seizures? Have you had any seizures since? No seizures, okay, fingers crossed.
I know.
You might still have some in the first few weeks because there is thumb bruising, but the fact that you haven't had any is definitely a good. But it's still very early days. So today is really to check that you have recovered well from the operation, that you haven't had any infection, and which there is not any sign of. But you still have to take it easy until week 6.
She has recovered fantastically from the operation. She's still taking her time before going back to work, but she's able to do everything she was doing before. She's able to walk, talk, socialize.
To be honest, I was expecting to see a bit of a black eye today. Actually, there isn't. So
you did good.
And your hair already growing. Most of incision, except for a tiny bit, is in behind the hairline, so will be completely disappear.
Thank you for everything that you do.
Yes, thank you.
Hands, your wisdom. Thank you so much.
No, it's been such a pleasure to take care of you. And I really hope this works for you.
I hope so too. Yes, thank you. It's been a couple months now. I am doing great. I'm able to return to work. I'm able to cook, clean at home, hang out with my family, slowly improving daily. Thankfully, I've been seizure-free. Hi, good morning. My name is Janet, one of the endoscopy nurses. The impact of being seizure-free will be that there's a lot ahead of me that I can get done, or any goals that I could not get done due to me having seizures in the past, I can now get done. The thing that I'm most excited about being seizure-free will be the day that I can drive. I drive better than my husband. But of course, until I get the doctor's release saying that I'm free to drive, then okay, I'll let my husband drive.